So coming to the Nidana and Lakshana of karnini yonivyapath, according to Acharya Vakpada, the Lakshana is like that. Akala vahanad vayu sleshma rekta vimorchidaha karnikam janayed yonau rejo marga nirodhini. So, according to Vakpada, this karnini yonivyapath is a vada kapha pradhana roga, and there is the involvement of rekta dhatu. Akala vahanad means when a woman make early pushing during the labor or bearing down efforts are made by the lady during the labor at prematurely, then the vada get vitiated there, and as a result, along with the sleshma dosha, it produces karnika at the yoni. So akala vahanat vayu sleshma rekta vimochidaha karnikam janayet yono. So there is karnika, like karnika is formed at the yoni. That means some protuberances are formed at the yoni during the when premature bearing down efforts are made by the lady. Due to the Mata vitiation along with the Sleshma and Rekta, there occurs the production of Karnika at the yoni. And this Karnika will lead to Rejo Marga Nirodhini. So when the menstruation comes, this Karnika produce obstruction to the proper flow of the Rejo Marga Nirodhini. So the Lakshana is Rejo Marga Nirodhini due to this Karnika at the yoni. So Akala Vahana Vayu Sleshma Rekta Vimorchidaha Karnikam Janayet Yonau Rejo Marga Nirodhini. So Karnini Yoni Vyapat is a Vada Kapha predominant Roga by Acharya Vakpada. So the Lakshana seen are Karnika at the Yoni and also Rejo Marga Nirodhina are seen. Charakacharya has explained similar to this Vakpadacharya. When the pregnant woman strains prematurely to expel the fetus, Vada and Kapha vitiated. As a result, some sprouts like growth, that is karnika, are formed at the yoni, and as a result, there is obstruction of blood flow, similar to Vakpadacharya. According to Sushruta Acharya, this Sushruta Acharya explains only the role of kapha dosha in the manifestation of karnini yoni vyapat. It is a sleshma pradhana roga according to Acharya Sushruta. The lakshanas are similar. Karnika is formed at the yoni. So, but it is a kapha pradhana roga. So, kapha pradhana symptoms are also seen along with this karnika. That means some excessive discharge, then pruritus means kandu, etc. are formed in this karnini yoni vyapat according to Sushruta, since it is a vada kapha pradhana roga according to Sushrutacharya. So according to Charaka and Vakpada, it is Vada Kapha Pradhana, but according to Sushruta, it is a Kapha Pradhana Roga, and it produces symptoms like discharge and itching along with this Karnika at the yoni. So this condition can be correlated with the cervical erosion. What is cervical erosion? A condition where the squamous epithelium of the ectocervix is replaced by the columnar epithelium. Usually in a normal cervix, in the left side we can see a normal cervix and the right side a cervical ectropion. The cervical erosion is otherwise called the ectropion. So in a normal cervix, in the figure we can see columnar epithelium in the endocervix, the portion of cervix inside this uterus. Then in the outward part, the outside part of the cervix, here it is called the endocervix. In a normal cervix, there is columnar epithelium here and a squamous epithelium here. In the ectocervix, there is squamous epithelium, and in the endocervix, there is columnar epithelium. But in a case of cervical erosion or ectropion, the columnar epithelium here may grow outward and extend to the external os. Here also we can see In the ectocervix also we can see the squamous epithelium is replaced by the columnar epithelium of the endocervix. So cervical erosion is a condition where the squamous epithelium of the ectocervix is replaced by the columnar epithelium of the endocervix. So what are the etiology? Congenital and acquired. At congenital means at birth, normally up to 3 days, this condition is seen. In acquired cases, there are two causes. One is due to hormone cause and other due to infection. Hormonal cause, in this, there are two conditions during pregnancy and in pill users. When there is high estrogen level, the ectocervix may be, the squamous epithelium of the ectocervix may be replaced by columnar epithelium when there is high level of estrogen. This high level of estrogen is in cases of pregnancy. So, there is erosion in cases of pregnancy. And in pill users, then contraceptive pill users also there is high estrogen. So, cervical erosion may be seen. Then in infection cases, if there is chronic cervicitis associated, then this cervical erosion can be seen. So the causes of mainly congenital and acquired cases are due to the hormones and also due to the infection. What are the symptoms seen? The symptoms seen are vaginal discharge, may be copious. It is thick in nature. Then contact bleeding can be seen. After coitus, there may be bleeding from the site. Then if associated with the cervicitis, backache, pelvic pain, and even infertility may be the result. So the symptoms produced are vaginal discharge, then contact bleeding, associated cervicitis. If associated with cervicitis, backache, pelvic pain, and infertility may be seen. And the sign. When we examine the cervix by a speculum, we can see this reddish discoloration at the ectocervix. So the areas are usually reddish in color, and also the margin is usually clear, and some sprouts like reddish changes can also be seen in the ectocervix when we do a speculum examination. Coming to the management, all cases of cervical erosion should be undergone a cytological examination. So pap smear can be done in cases of cervical erosion to exclude malignancy and dysplasia. So all cases should undergo a cytological examination. Then the surgical procedures done are thermal cauterization, cauterizing the cervical erosion part, then cryosurgery, then laser vaporization. Coming to the chikitsa explained in our classics, Uttaravasti can be done with the thaila prepared out of the Jivaniya Dravya. Then yonivyapath can be done. This is similar to the cauterization technique. Yonivyapath made of Pushta, Pippali, Arka, Saindava, Lavana and Ajamutra can be done. Then Kafahara Chikitsa can also be done here. As this Karnika, as this Karnini is a Kapha dosha. Kapha dosha is there and a Kapha predominant state, we can do Kafahara Chikitsa. As there is a discharge, then itching are also seen. We can do this Kafahara Chikitsa, Yonivyapath, and Uttaravasti is also explained in our classics. So commonly we are using in our OPDs, Yoni Prakshalana is done to reduce the discharge. Then Kshara Karma is also doing with the, some drugs to reduce this reddish sprouts and to control the erosion. Then internally, Musli Kadiradi Kashaya, Chandraprabha Badi, etc. are given when associated with the cervicitis to control the erosion. The treatment for cervicitis are done when if associated with the cervical erosion. Locally, we use yoni prakshalana, yoni varti, and ksharakharma. This is all about karnini yonivyapath. So karnini yonivyapath, then its correlation, cervical erosion are explained. Thank you all.